It was a year ago, on the 12th of January 2010, that an earthquake of 7.3 magnitude struck Haiti. The capital, Port-au-Prince, lay in ruins, as did towns elsewhere in the country. The catastrophe left 200,000 dead and as many injured. Médecins Sans Frontières teams who have been working in Haiti for 20 years were able to respond immediately, treating dozens of patients with severe injuries within hours of the quake. Several MSF staff also found themselves trapped in hospital buildings.
We were all crying out, "Jesus, Jesus, Jesus." We thought we wouldn't get out of there, but we did, about 10 hours later. We were in the emergency room. We kept on crying out for help, but nobody came. We ended up freeing ourselves.
Immediate action was required to treat in the best conditions possible the large numbers of patients presenting multiple trauma and fractures, many needing surgery. Teams on the ground set to work and rapidly felt the benefits of the massive international support. Across the world, hundreds of thousands of people showed their solidarity and helped fund the Médecins Sans Frontières relief effort. MSF received €104 million, enabling teams to treat more than 400,000 people in just under a year, and to send several thousand tons of material.
Sur les 104 millions reçus pour l'urgence.
Of the 104 million received for the earthquake emergency, 76% were spent on direct consequences of the earthquake. The rest, so about 24 or 25%, will be spent on the emergency response to the current cholera outbreak. The entire 104 million euros will have been spent in the year 2010.
Nearly a third of MSF's expenses were devoted to logistics, construction, rehabilitation, or the ongoing maintenance of health structures, without which the teams would not have been able to work. St. Louis Hospital is just one example. MSF decided to set up an inflatable hospital on this football pitch, one of the few places left intact by the earthquake. 2 weeks after the disaster, the hospital was ready to admit its first patients.
Oui, c'était le premier patient opéré à Port-au-Prince sous la tente.
That was our first surgical patient under the tent here in Port-au-Prince. The operation went well, both the anesthesia and the surgery.
Sur le plan chirurgical et sur le plan anesthésique.
Bonjour.
Although initially focused on treating fractures, Médecins Sans Frontières rapidly extended its activities to include the provision of psychological care.
We asked the children to draw something they loved, something they cherished, and that they lost in the disaster. This child here drew a picture of his sister. I've been seeing children who are having trouble sleeping and who are having nightmares.
After the emergency phase, MSF introduced rehabilitation care, providing physiotherapy and reconstructive surgery.
When she arrived, she had a skull fracture with bone loss and a scar holding back her eyelid. She can't close her eye, which is very uncomfortable for her and could lead to other eye complications. She suffered further bone loss here too, so we're going to perform some plastic surgery.
The earthquake left many Haitians injured. It also left the already fragile health system in shatters and unable to provide the specialized care needed by pregnant women, victims of violence, or patients with severe burns. In the middle of October, another emergency arose, with the first cases of cholera breaking out in the Artibonite region. The disease, which Haiti had not seen for over 100 years, spread rapidly. In the center, to the north, in Port-au-Prince, and at the beginning of December, cholera reached the south of the country.
It's already spread also into the rural areas of the south, where you have very low population density, but we're having reports of high mortality in small villages. So it's going to be a challenge to be able to help those populations.
By the 1st of January 2011, MSF had treated 84,500 patients in nearly 50 cholera treatment centres throughout the country. On the 12th of January 2011, a year will have passed since the disaster. The healthcare system has yet to recover. Médecins Sans Frontières will continue its activities in 2011.
MSF has been responding to the medical needs of Haitian people for the last 20 years. Last year, we responded to the emergency. We will continue our commitment to the Haitian people in the coming years and try our best to meet the medical needs in the country.
A year ago, Médecins Sans Frontières set about its largest ever mission. The scale of the disaster and the means deployed were unprecedented. 8,300 members of staff have contributed to MSF's relief effort. Their work would not have been possible without the mobilisation and financial support of hundreds of thousands of donors.